Good. Then back far as you can go. Good. Turn. Good. Turn. Good. How's that shoulder area in through here?
Yeah, it's better.
So Ehsan's here for a follow-up, and he had formerly a functionally short leg, but he's doing really well. We got his orthotics in, which are addressing his flat feet, and also his leg lengths look perfect. Very good. Whole leg straight, lift it up high as you can go. Good. Other side high as you can go. So that looks really good. We're going to do something a little different today. We're going to do a little work on the shoulder here. We're doing some cupping with some silicone cups here, working on the tissues here. So Ehsan's having some issues in his thoracic area. He's got a particularly stubborn issue going on in this right side of the scapula, between the spine and the scapula. He's got a lot of recurrent issues in this thoracic spine. So we're using the rock cups here to get a little bit of tissue distraction in here. So what we're going to do is pull up the tissue and get some drainage in there and get some mobilization. We're going to work with some of the adhesions of the scar tissue in there. We're going to actually have him do some extension exercises for his thoracic spine. So we'll do a little bit of mobilization with the cupping on, okay? So we're going to go through that right now. Okay, so here I have him doing his little bit of thoracic mobility exercises, and we're using these silicone rock cups to get some tissue distraction in there. You doing okay?
Yeah.
Good. So what we're doing is we're pulling up on this tissue, trying to free up any underlying adhesions in there. Perfect, and just relax. And we'll give him a break, and I'm going to just adjust the suction. Now I like these silicone cups a little bit better than the glass cups. They're a lot more tolerable for the patient, and as you can see, we can do a whole bunch of functional stuff with the cups in place. So it's really cool. I like to use this sometimes on the athletes who are having some stubborn issues, or even regular patients who are having some stubborn issues. Just a little bit of additional soft tissue work. Now arms straight out and extend. That feeling okay?
Yeah.
Good. So you feel a little bit of pulling in that area?
Yeah.
Yeah, perfect. Good. And we're going to have them cycle through 4 more, 3 more, 2 more, 1 more, and last one. Perfect. Good. And relax. So we'll get some tissue distraction in there. We're going to just keep those cups on for a little bit longer, work on his neck. We're going to use these pulse instruments. He's got a little tiny fixation in this left cervical capsule. We're using that impulse instrument, firing at the frequency of the spine to open up that joint. 3 more, 2 more, 1 more, and last one. Perfect, and relax. Good. This will go away in a little bit. Again, not painful. Treatment really shouldn't hurt. You're going to feel it, but it's all designed to make a quicker recovery. So you can see the little bit of welts raised by the silicone cupping, but again, nothing to worry about. And this is a really effective type of soft tissue treatment that we'll use on him. Yeah, good. What I'm just doing here, I'm just moving the tissue here, just pulling up on the tissue, get a little bit of extra mobilization. Any pain with this at all? Perfect, good. So just pulling this. And again, all this is doing is creating a little additional space in the tissue levels, break up some of the micro adhesions in here, and create some drainage in here, because you're going to work at this chronic issue that he's having in the scapula vertebral area. And using the glide prevents any chafing or friction to the skin, so it makes it a little bit more comfortable. Now, this procedure, it's a little bit more aggressive, but he's a big guy, he's a tough guy, he can take it, and he knows that we're trying to get this tissue to respond a little bit more quickly, because And an athlete who works out on a daily basis, that body, those muscles and those tissues undergo micro trauma, and that's how the muscle gets larger or hypertrophies, is actually due to that micro trauma. So he's constantly in a state of flux, rebuilding the muscles, breaking down the muscles so they can build up and get more tone, more definition, and larger. And that's a lot of competitive bodybuilders need that recovery time to be quick, so, especially when they're preparing for competitions. Relax your head, deep breath, blow it all the way out, and relax. Good. And deep breath, blow it all the way out, just relax. Good. How's that feel? Good. How's that feel? Good.